This is Michael Smith of MedPage Today. I'm here in Washington at the joint meeting ICAAC-IDSA. I'm speaking with Dr. Sarah West of Oregon Health and Science University in Portland. Dr. West is reporting a small outbreak of a relatively new form, at least to the United States, of a cryptococcal infection. Dr. West, how did you go about finding, what is this infection and how did you find it?
Well, Cryptococcus gattii is the infection that we're reporting, and it's in Cryptococcus. It's a family member, I guess, of Cryptococcus neoformans, which most people are more familiar with, which is they're endemic fungi. And gattii is a type of fungal infection that has been found mostly in tropical climates in other parts of the world, but not really North America. And in the late 90s, early 2000s, there was an outbreak in Vancouver Island, and they've described about 200 cases since then. And now we have started to notice cases in Washington and Oregon that had no prior travel to Vancouver Island, to the area of the previous outbreak, and it causes, CNS disease and pulmonary disease, and can be quite severe.
You're reporting, I think, 19 cases, most of them in the last couple of years. What kind of outcomes are you getting? Are these patients doing well? Are they easily treated?
Yeah, I think most of the cases that we are reporting are ones that we've heard about really by word of mouth and talking to providers around Washington and Oregon, and sort of having a heightened awareness after we saw the first case that we had seen back in 2006. And so the outcomes, unfortunately, have been rather poor in the spectrum of how you would hope these people would do. I'd say of the patients that we saw, we had about 20% of our patients had died from either from or with their disease. And the ones who survive have very long courses of treatment, very prolonged hospitalizations, and a lot of morbidity from their infections.
I see. This is still a small number. Even the outbreak in Vancouver Island is relatively small in terms of sort of major pathogens. But nonetheless, is this something that we should be worrying about, or should we just be raising the flag that this is a possibility that physicians should be aware of?
Yeah, I think the Vancouver Island outbreak was actually a pretty big outbreak in the sense that their rates of incidence were higher than that in other areas of the world where it's endemic. They had a much higher incidence rate for in that area. Our numbers are obviously, yes, very low, and I think that the general population doesn't need to be worried about it. It's more something that I think providers in these areas need to be aware of, keep in the back of their mind, and that researchers need to focus more efforts on figuring out where this is coming from, who is at risk to be infected and affected, and really what the best treatment courses are and how we can help improve the outcomes in these patients.
Okay, well, we'll watch this with some interest. Thank you very much, Dr. West.
Thank you.
I'm Michael Smith, MedPage Today.